Ladies and gentlemen, distinguished speakers, esteemed guests, good afternoon and welcome to our virtual panel titled From Evidence to Action, Climate, Health and Migration Case Studies from the MENA. This event is hosted by the CLI Health Program and the Refugee and Migrant Health Program at the Global Health Institute at the American University of Beirut, in collaboration with the International Organization for Migration IOM, Regional Office for the Middle East and North Africa RO MENA. This virtual panel is part of a 2025-2026 joint event series organized by IOM and the Global Health Institute at AUB, focusing on the climate change, health, migration nexus. My name is Hadil Mdahli. I'm the Academy Division Manager at the Global Health Institute, and I am honored to be your Master of Ceremony for this event. Today's virtual panel will begin with a round of presentations, followed by an expert panel discussion, and will conclude with a Q&A session. In the first round, our speakers will present case studies and field-driven insights on how climate change is shaping health outcomes and mobility patterns in vulnerable communities across the MENA region. We will begin with our first presentation by Ms. Nurhan Mhaidli. Ms. Nurhan Mhaidli is an environmental engineer and a CLI Health Program Associate at the GHI at AUB, working on the climate health nexus across vulnerable communities in the MENA region. She supports the CLI Health program through field research, evidence translation, and community-focused capacity building initiatives. Her experience includes water risk assessment and waste minimization projects and continues to focus on environmental health, climate resilience, and health equity. Ms. Nurhan, the floor is yours.
Thank you, Hadil, for this introduction. And allow me, on the behalf of my CHP team and on the behalf of my colleagues at the Global Health Institute, to thank IOM for their collaboration, Dr. Mikella, Dr. Mahmoud, and all the team, and to thank our esteemed speakers for being engaged. So today I'll be sharing some field insights from our work at the CLI Health Program, where we look at how climate, health, and social justice intersect, with a particular focus on the vulnerable communities across the MENA region, most specifically women whose stories often remain unheard. I'll start this presentation talking about our program. CHP aims to explore the nexus of climate change, health, and social justice, with a particular focus on vulnerable communities across the MENA. Throughout this program, we try to understand the impacts of climate change on health at multiple levels and evaluate strategies that strengthen climate resilience across communities, healthcare organizations, and health systems. So one fact that is unchangeable, as you all know by now, is that climate change is a major health threat globally and particularly across the MENA region. So as a part of our ongoing project implementation, and when we were trying to explore what's existing in literature as pertains to this nexus, one gap was impossible to ignore, is that women's voices are almost completely missing from climate health research. We know the science, we know temperature is increasing, we know storms are intensifying, but what we didn't know is that how this translates into daily lives, into exposure that shapes health, stress, decision-making, access to healthcare, and so on. So this is what this study is about. It's about understanding the impacts of climate change on women's health, on their bodies, on their relationships, on their ability to access healthcare, and to understand how the socioeconomic disparities might reinforce these vulnerabilities, and to see if there's any gender inequality lens that might get amplified during climate shocks on this group specifically. So this project is a regional project. It has implementation in Lebanon, Egypt, and Morocco, and it has so many other objectives. It's tackling so many other objectives. But what we are presenting today is what's been implemented in the vulnerability assessment of the most vulnerable communities across the MENA, in Lebanon specifically. So 4 focus group discussions were conducted across 4 governorates in Lebanon: Akkar, Bekaa, South, and Beirut. And each focus group discussion included 8 women participants, comprising a mix of vulnerable Lebanese and refugee women. And as you can see, this mixture of nationalities is important in order to understand how women from different backgrounds share the same burden, getting amplified by extreme climate conditions. And also, it's important to note that these women were facing intersecting layers of poverty and lack of access to resources. So our participants were like vulnerable Lebanese and refugee women aged 18 and above, living in extremely challenging environments. Some lived in poorly ventilated homes, damp structures, mold-affected rooms, or in informal temporary tents. Many of them were unemployed, and those who did were working informally in agriculture, cleaning, cooking, or tutoring with an average household income around $250 per month. So as you can see, these conditions already placed heavy pressures on women before even starting to talk about climate change and climate-induced health impacts that also might push these women further and closer to the edge. So women reported health impacts that made worsen during extreme climate conditions on both levels, physical and mental. On the physical level, they reported fainting, headaches, heat strokes during heat waves, chest allergies, difficulty breathing, skin infections, stomach issues, pregnancy and menstrual complications. And on the mental level, they reported anxiety, sleep disturbances, mental exhaustion, stress, and difficulty concentrating. And although these symptoms were like purely triggered by extreme climate conditions, many noted that their poor financial resources, poor housing, overcrowding, the constant caregiving pressures made these symptoms even worse. On the social and economic level, women described losing work days due to illness or extreme weather. And it's important in this case of the people who are working informally, like in agriculture and so on, where their lost daily income is not compensated. And at the same time of having this decrease in income, they were experiencing an increase in household expenses. For example, they had to buy for water due to water scarcity. They had to afford for medications due to frequent diseases that were amplified by climate events, heating and cooling expenses due to frequent heat waves and cold waves. And on the social level, the climate pressures heightened stress within households. For example, some women reported increase in marital tension, verbal violence, and emotional strain. And all these impacts were getting amplified by the underprivileged financial situation of these families and by the fact that women carried a heavier caregiving burden. She had to care for children, managing the home, and ensuring basic needs are met, regardless of difficult conditions the families are passing through. When we asked about their ability to access healthcare, several barriers emerged. For example, heavy rains and storms often flooded roads and made transportation unsafe. The cost of visits, medicines, medical tests, and transportation costs was also a major obstacle in almost all of the focus group discussions. And on the level of the PHCs, some PHCs were like overcrowded as they reported, understaffed with poor hygiene or seen as offering limited or inconsistent services. And to cope with these induced climate shocks, they like used traditional and improvised coping strategies. Many wore like plastic raincoats, especially those working in agriculture, or layering cloth, hat, and gloves to cope with the cold waves. For example, some kept water cool by wrapping bottles with a cloth to maintain its temperature because they don't have access to cold water in heat waves, for example. And also to cope with this, or they used with the illness also induced by climate events, they used herbal remedies and home treatments. They used old prescriptions to avoid consultation costs, and often borrowed or created cloth pads when supplies were unaffordable. There was a gender inequality theme that was obvious in almost all of the focus group discussions. For example, women were restricted in their mobility. They often needed permission to mobilize, while men moved more freely in extreme weather events. Also, there was a gender health bias. Men's illness was always prioritized. Women were often told to endure, take a pill, and have some rest, and to not go seek healthcare, for example. On the financial level, women do not have control over their own economic resources, even though they are working for the same working hours, for the same field, in the same days of the week as their husbands. And also this is getting amplified by the dual responsibilities that fall entirely on the shoulders of women, who, especially for those working outdoor in agriculture or cleaning, they described long hours and harsh weathers with little protection, followed by a full second shift of caregiving at home. So I'm gonna highlight like 3 case studies that were like critical during our focus group discussions, and I'd like to bring these experiences closer. For example, a restaurant cleaning staff described extreme fatigue during heat waves, which eventually strained her marriage and increased her risk of violence. And here we're speaking of physical violence. For example, another woman who was living near the Litani River, she had to deal with her family with chronic flooding and mold that repeatedly damaged their homes and health. And there was another case where families, pertains to displacement, they were relocated from Bihar to south due to extreme humidity or heat. They saw improvements in health, but struggled with increased isolation and reduced access to services. So all in all, findings are clear. Climate change already is amplifying pre-existing social and gender inequalities. And these women are facing heightened health risks, economic stress, and in some cases, raising their exposure to violence in contrast of a very low and reduced adaptive capacity to respond to these climate shocks. And an effective climate resilience requires addressing environmental, socioeconomic, and gender barriers altogether. Thank you.
Thank you, Ms. Nurhan, for your presentation. Our second presentation will be delivered by Dr. Alia Mohammed. Dr. Alia Mohammed is a public health professional with the World Health Organization in Iraq, where she leads national programs on health promotion, social determinants of health, environment, and migration health. She works across multi-sector partners to advance health resilience, strengthen community systems, and promote evidence-based advocacy that supports equitable, people-centered health policies. Dr. Alia, the floor is yours.
Good afternoon, everyone. Can you see my screen?
Yes, we can see your screen.
Perfect. Thank you. Thank you very much for the introduction. I'll be very short. I'll speak on WHO Iraq response and the triangulation of climate, human movement of migration, and health. Before we start, let me just show you a few photos. These photos are from Iraq, WHO, during our visits or field visits to the southern region, where we were doing some assessments, specifically the vulnerability and adaptation assessment. As you can see, the first photo is a dead buffalo because as you might know, buffaloes usually prefer the shallow water for cooling, hydrating, and feeding. And more than 5,000 buffaloes passed away due to climate change and water scarcity in the southern region. The other photo is families migrating or leaving their lands in Diqar, moving to Basra, which is the hub for most of the climate migrants. The third, we can see how the whole area used to be water, and now we see how little left from the marshes or the marshlands, as well as here, all the different, the ecosystem was really highly impacted due to water scarcity and water salinity as well. Iraq is one of the highly impacted countries by climate change, and specifically when it comes to water scarcity and food safety. And climate pressures and drives different internal migration, intensifying different health risks among those vulnerable communities. And it is actually reshaping population movement and different health outcomes in those populations. And it affects, as you've mentioned, Nurhan, different determinants of health, including the environment, clean water, clean air, sufficient food, and even secure shelter. As you might know, climate impacts different or composes different climate-related hazards like the extreme weather events, the heat, the sea level rise, air pollution, vector-borne diseases, waterborne disease or water scarcity, and this impacts the vulnerability factors, demographics, geographic, socioeconomic, and other factors, and exposure and impacts the infrastructure, the health infrastructure, the health workforce, the populations and communities, and the whole ecological system, and eventually multiple complex health outcomes. In Iraq, based on the vulnerability and adaptation assessment that was carried a few months back, and now it's in the endorsement process, we've seen an increase in vector-borne disease, especially the hemorrhagic fever, Crimean Congo hemorrhagic fever, increase in waterborne disease, specifically cholera, respiratory illness increase, especially the asthma, mental health as well was one of the highly impacted by climate change as well, and migrants as well had other related skin diseases. Basra and the southern region in general, and Basra is mostly or highly impacted by climate change. And we've done this projection to see the impact of the climate change on Basra. And if we've done nothing by 2100, and we've done different scenarios, RCP 2.6, 4.5, and 6, and these are different scenarios. This scenario, if we've done some adaptation and mitigation measures, and 6 if we haven't done anything, and there will be an increase in 7.6 degrees centigrade by 2100, shorten in rainfalls, increase in dust and sandstorms, and it would reach more than 7 or 8 times higher than the WHO guidelines, losing of different agriculture lands, and currently, honestly saying, according to different national documents, we're losing around 25,000 hectares on an annual basis. Most of them are in Basra. And unfortunately, the water availability dropped from 2,300 cubic meter to 602 cubic meters in 2023, which is below the global scarcity threshold. So there is a serious problem that is done or being done happening in Basra due to climate change impacts. As WHO, we've been working supporting the government using the WHO operational framework on the adaptation and mitigation, but the focus on the adaptation component to build a climatic resilient health system. Now we know when the system, any shock happens or event happens, for example, let's say an outbreak, the system will drop. Our hopes are not for the system to collapse, not that for recovering, but being worse than before. We're looking into these scenarios. Recover to the pre-event, recover for a better situation, or transform. The things that we've been doing to do the WHO framework was actually developing evidence, the evidence generation and policy level engagement. And I think this is happening, what I will say is happening in most of the region. We don't have enough evidence to prove that climate is impacting health. Show me the evidence. And whenever we talk, they say, what is the evidence? So we've been working, this is even when we speak to the government itself, they say, show us the evidence. And even when you speak to international agencies, donors, you name it. So we've done the first ever national vulnerability and adaptation assessment across all the governorates to map where the Iraq climatic health risks. And based on this VNA, we've developed the Health National Adaptation Plan, which will be part of the NAP, which is the National Adaptation Plan, and accordingly part of the NDC, the National Determinant Contributions. And this is the first ever national framework for health adaptation action. As well as we've done a climate migration cap to assess what's happening in those who are migrating due to climate, their knowledge, attitudes, and practices on the impact of the climate on their health, and specifically in Basra. Basra Health Adaptation Plan, and this is part of our joint project with IOM and UNDRR. We're working on a local adaptation plan for climate migrants, as well as we started considering migrants due to climate under the community protection strategy, which focuses on the community surveillance approach and using migrants, internally displaced and vulnerable populations as our focal points for the community surveillance and improving the e-warning system or the early warning system. As well as we started pushing the climate agenda into the national table under the One Health Committee. For those who doesn't know, the One Health is an approach that used by WHO, where we put the three main components, which is human health, animal health, and environment. So now we have this higher committee led by the Prime Minister himself, and different three ministries: Ministry of Health, Ministry of Environment, and Ministry of Planning. And now under the climate agenda is one of the main technical agendas under the One Health Committee, as well as we've been supporting Iraq with the ATTACH, which is the Alliance for Transformative Action for Climate Change and Health. And now, whatever we do internally, we present it for the global community, our global climate community. In addition to this, we've been working on risk communication and community engagement. We've done, honestly, many trainings, and we've trained, I think, even more than hundreds of students and volunteers to deliver climate health messages and awareness for affected populations under different programs, whether under the YCAP, which is the Youth Climate Action Program, under the MMPTF project, as I mentioned, jointly with IOM and UNDRR, or with the IFMSA, which is the International Federal Medical Association for Medical Student Association. We've done hundreds of online and offline campaigns on climate impacts with focus on vulnerable communities, and engaged with many community leaders, religious leaders, and local stakeholders to push the climate agenda among their communities, as well as focusing on the delivering health services. We've done different capacity building trainings for healthcare providers in highly impacted areas by climate change, aligned with the WHO Health and Migration Framework that we used while training them on different climate and health competencies. Moving forward, since now we have the assessment and we have the plan, we have all the baseline to take the actual actions, and we have a good RTCE component, we look forward strengthening the climate-sensitive diseases and the syndromatic surveillance, including in migrant and displaced communities, establishing the community-based surveillance system with the migrants under the community protection strategy, and adding the climate-sensitive indicators under the eWARN system. The eWARN is there, but we want to integrate the climate-sensitive indicators and expand the eWARN system to the high-risk and migrants area. So this is, in general, our response and our vision for the future to support Ministry of Health and the government in the climate, health, and migration nexus. And here I'll stop. Thank you very much.
Thank you very much, Dr. Alia, for your presentation. We now move on to our third presentation by Dr. Mahmoud Megdadi. Dr. Mahmoud currently serves as a public health officer at IOM Jordan. He specializes in global health, epidemiology, and migration health, with extensive experience in climate change and global health, public health programming, emergency preparedness, and evidence-based policy engagement across humanitarian and development contexts. Dr. Mahmoud, thank you, and the floor is yours.
Thank you so much for the introduction. Welcome to everyone, and I'm glad to be here with you, all of you. Actually, I'm going to start about, I would say, simple details about the climate change component in Jordan. And
Dr. Mahmoud, apologies. I'm sorry for interrupting you, but I just wanted to let you know that the presentation is not in full mode, in case you want to share it in full mode.
unfortunately,
Yes.
Is it working now?
It is working now.
Good. Thank you so much. So getting back to the climate change in Jordan, actually, what's happening on the ground is that we have a lot of challenges when we're talking about climate change component and portfolio on the national level. As we all know, climate change is a very, very important topic, and the impact of climate change is impacting, or let's say, hindering the whole health portfolio, the public health sector and the private health sector, in addition to the general population public health, when we're talking specifically about it. But also at the same time, the most important thing about climate change is that it's very simple, and at the same time, it's so much complicated, as unfortunately, this is a kind of gap and challenge that needs to be highlighted by everyone, let's say, working on climate change in general. What we are facing during the implementation of our climate change projects with the government, with the people, with everyone, is that there is a kind of weak awareness about how climate change is impacting everyone and how it is actually impacting all the sectors. Unfortunately, I would say when we're talking about thematic areas, climate change is not considered a kind of top priority for most of the thematic areas that we are including when we actually are working or intervening about the climate change in general. So what's going on is that unfortunately also it is taking a lot of efforts from everyone to deal with scattered impacts and challenges without being aware that these impacts are actually part of more general and more, let's say, bigger portfolio, which is the climate change. So health sector is dealing with vector-borne disease as a kind of separate component. Agriculture is doing the same. And also when we're talking about NGOs and the UN agencies, because it is taking a lot of, I would say, more efforts, better efforts and application of work from different entities. In Jordan, in general, the country is considered one of the countries that is impacted by climate change among the world. And we have very important, I would say, and intense impacts of climate change as, for example, water scarcity is very significant in Jordan. We're talking about almost 61 square meters per person renewable fresh water per each year. And as we all know that the cut point or the threshold is almost 500 square meters. So we are way below the cut points and I would say the thresholds of being water scarce countries. Also, warming is very clear in Jordan, and unfortunately, during the last few years, it is more significant and more clear, and the people started feeling it, especially the people working in agriculture and the people who are working, I would say, most of the day outside their offices and their houses. Rainfall is declining, and also annual precipitation has decreased by 5 to 20% since the 1960s. And also the most important thing is that the nature of rainfall is now different. So it is a kind of, I would say, more complicated, and it is having a kind of impacts on, I would say, the health, the public health sector, in addition to the agriculture, the finance in general, and on the population mobility, which we are going to explain later on. So once we are talking about gaps and challenges about climate change in Jordan, we are talking about different level challenges. So if we are going to start with national level, unfortunately, we don't have enough research and I would say informative data that can be helpful for the decision making. Once we are talking about vulnerable groups and specifically the migrant population, it's getting more complicated because we already lack a lot of data about the migrant population, about their lives, their, I would say, health-related data as well. And once we don't have these data, it's going to be a little more complicated to get to a kind of decision that could be inclusive for the migrant populations in general. In addition to that, we have a kind of weak coordination between the different governmental entities, in addition to all the NGOs and I would say, partners that are working on climate change, which most of the time get us to the point where we are duplicating the work and the efforts and not moving for the same, or let's say, one strategic aim. On the subnational level, we have capacity gaps related to climate change in general. If we're talking about the public health sector, we need a training for the healthcare providers in addition to the subnational stakeholders. And also, again, we have the problem of the weak coordination. And as I think everyone's aware, we are talking about climate change. Climate change is impacting different sectors in different ways. And that makes it, let's say, very important and very sensitive to deal with. So it's not, when we have like a kind of climate change issue, it's not impacting only the public health sector. It involves like different sectors, different thematic areas, and at the same time, that makes it much more difficult to deal with, because the most important part of management of such an issue is the coordination. And unfortunately, the coordination component on the national level and subnational level is a kind of, I would say, there's a huge opportunity to enhance it, and it needs a lot of work and cooperation from all the sectors to be able to reach to a kind of clear way forward looking in that. In the community level, we have the issue of lack of awareness. And when we are talking about lack of awareness, it's not only about climate change, it's also about the impacts of climate change and how that is impacting the life of each single person. So, for example, recently we are talking about like the olive oil season in Jordan. We are facing a huge challenge this year with the amount of olive oil that is used to be produced every year. But for example, in Jordan this year, it's almost less than the half, and the prices are much higher. But nobody's connecting that to climate change. Nobody's connecting that to the impact of climate change on agriculture, on health, on finance, on everything. So that's the main problem. And also, we have a kind of weak outreach to vulnerable groups, especially when we are talking about migrant populations. Most of the time, when we're talking about migrant populations, there is a kind of misunderstanding in the community and also sometimes on the stakeholders level that we are talking about refugees. And most of the time, when we are doing like a lot of work on refugees, we neglect the migrant population, the migrant workers, and the ITSs, which makes them much more vulnerable. And most of the time, let's say, when we have like messages that needs to be delivered to migrant population, unfortunately, we lack proper communication methods, and we lack providing this information in a kind of, let's say, easier way and more simple, let's say, a way. Also, when we are talking about the cross-cutting challenges, climate portfolio often doesn't systematically capture ongoing and compounding challenges across levels. It is impacting, as I said, different levels and different sectors, but each sector is working with these challenges in a kind of separate way. And also the most important thing, which is the difficulty sustaining long-term financing for climate in general. And I don't think this is only for Jordan, but Jordan is getting a lot because of that. On Jordan efforts, actually, we have two main projects. The first one is harnessing synergies between climate change adaptation and risk reduction in migrant-exclusive health system responses, which is being led by IOM and cooperation with the WHO and United Nations Office of Disaster Risk Reduction in 3 countries, as Victoria just mentioned before, and it's a 2 years duration project. Our main goal is to strengthen the links between climate change adaptation and disaster risk reduction in public health using a migrant inclusive and gender sensitive approach. The other project is about focusing on human mobility, including the displacement and migration in the context of climate change, environmental degradation, and disaster risks, which also is focusing on the health portfolio and how migration is impacting the health, and also how health is impacting the mobility of the people and the displacement. And the goal is to produce an on Jordan scoping study on how climate-related factors influence mobility trends in general, and it's focusing on the northern Jordan for a duration of 20 to 40 years, depending on each indicator. Climate change is already affecting health in Jordan across multiple pathways. We are trying to include the migrant population into the national climate or the national strategy in general, which includes the NAP and also the recent national climate change and adaptation strategy of Ministry of Health in Jordan. We have been working with Ministry of Health on the short-term action plan to raise the awareness of the population and also to enhance the capacities of the healthcare providers and the environmental health focal points around all the countries. At the same time, we have been identifying the most vulnerable locations to climate change, taking into consideration the migration component, in addition to the gender component, and also taking into consideration the disaster risk reduction and public health in general. These impacts of climate change can shape human mobility, and mobility conditions can shape health outcomes, which is connected in a very significant way. Our unique value add is to bring the human mobility lens into climate and health action, evidence, coordination, and community resilience in general. And thank you so much.
Thank you very much, Dr. Mahmoud, for your presentation. Now, for our final presentation in this round, we welcome Ms. Iman Ayoub. Ms. Iman Ayoub is a Regional Climate and Resilience Officer at the IFRC MENA Regional Office, acting as the regional focal point for climate and resilience, supporting 17 national societies and implementing climate-smart disaster risk reduction and resilience programming across diverse contexts, including urban and fragile conflict-affected settings. Previously, she worked as Regional Associate Project Management Coordinator at UNEP West Asia, coordinating environmental initiatives and contributing to regional environmental governance and sustainable development initiatives. She is a licensed environmental engineer and a member of the Lebanese Order of Engineers and Architects. Ms. Iman, the floor is yours.
Thank you so much, Hadil, and I would like just to confirm if my presentation is feasible for everyone.
Yes, we can see it. Thank you.
Yeah, thank you so much for the invitation and for organizing this important panel. It's a privilege to be here joining and to be talking on the behalf of IFRC, or what we call by the International Federation of Red Cross and Red Crescent Societies. And to share how our movement or Red Movement is addressing this critical nexus when we speak about the climate change, we speak about the health risks, and human-induced mobility. When we hear about the climate change, the first thing that we hear about is it's one of the triple planetary crises. We focus more, it's an environmental challenge. We neglect how it's directly inducing the health impacts or the displacement or migration, population movement issues. So happy to be joining here with my colleagues from other UN system, other entities, and with the GII, being an academic AUB university, where we can best explore the synergies and how we can work together more effective to address this nexus. And yeah, I'll be short. In my next presentations, I'll be focusing more on the work of our MENA national societies and the front lines, and sharing some key lessons. I will be very brief in my presentation because if the time allows me to speak on each country itself, it took me a lot. So briefly, yes, IFRC MENA regional office is based in Beirut, and we do work or span over 17 national societies, mainly in the Middle East and in the North Africa. It's clear that how this region itself is diverse when it comes to the political, geographical, and the economical characteristics. And adding to it, it's being characterized as one of the most hot spots for climate change. And those hazards also doesn't happen as an isolation. It's even combined with extreme fragility, conflict, and violence. This term within our movement, we refer to it as VCV, fragile conflict and violence settings. So just to share a glimpse about the uniqueness of this region. And how, yes, we as a movement, we try to address the community resilience, we try to achieve the resilience of the communities, but yet it is being not extremely hard, but it's being very uniquely complex when it comes to the interlink of those compound risks that I have been talking about. This slide, I will not be touching base in details about it. I thank Dr. Alia from WHO for talking more about it, but just as a reminder about the impacts of climate change and how it will be triggering the direct or the indirect health chain of impacts, and how it's important that when we talk about climate change, we cannot neglect the health impacts or we cannot speak about also migration as a movement only. It's more about about the health and it's more about the humanitarian crisis by itself. And also, when we speak about migration in general in our region, we cannot neglect talking about three main routes, mainly the central, mainly the western, and the eastern routes of movement. But when we talk about climate-induced mobility or movement, we are here more focusing about the displacement within the countries themselves. In the Middle East, if we took it as a hotspot for the climate change, we're talking about the extreme heat events, about the prolonged droughts, about the water scarcity, and about the floods. So countries like we're speaking about Syria, Iraq, and Yemen, and Jordan, and currently the booming news about droughts in Tehran. Those are mainly due to drought and collapsing water systems. So and also we can talk about Egypt and Lebanon when it comes to the threat of the climate-induced sea level rise and erosion. But it's important to note that our work as a movement, our work as a Red Cross or Red Crescent societies, yes, we are here to address the people in needs in every stages of the crisis. Examples are the food, like food and cash assistance, the emergency shelters, the wash support, the first aid and the psychological support, and the restoring family links and PGI, protection, gender, and inclusion activities. Yes, in general, we are working across all the movement, across all the region, across all the countries. But in particular, I want to focus about the humanitarian service points, the HSPs, and the mobile clinics. Among all the interventions that I have been talking about, this is special emphasis on these interventions that our national societies are doing, mainly because it's being as the quickest to deploy to support the people in move. Mainly the services that can be provided are related to the basic or urgent medical care, treatment of injuries and the consequences of the violence, health promotion and immunization, and the mental health and the psychological support, and in addition to the wash and nutrition support. And this has been active on the ground by our national societies, mainly from Egypt, Libya, Lebanese, Jordan, and SARC, Syrian Arab Red Crescent. I will delve more in details and I will take three key case studies where I'm mainly more showing the response of the national societies, both at anticipatory preparedness, if we're gonna take it from this angle, or from the angle of the direct response. So when we speak about, when we remember about the Algeria wildfires that were that was ignited in 2023. And it was a major climate-induced event that is directly forcing people to be displaced. So one of the key direct response interventions by Algeria Red Crescents were the ambulance services of the first aid, which we know about, like our movement. The first thing we think about it's about ambulance and the first aid, and also we speak about the psychological support and the hygiene kit and the food distribution. So yes, a strong emphasis in this slide is that climate hazards like wildfires are triggering displacement, but it's even compounded with interlinked other risks like the health risks. But yes, Algeria Red Crescent were proving to be the first responders. And another angle of anticipation or more integration intervention by Iraq Red Crescent. Currently, we're working to do a global force to flee case study series. And from MENA national societies, it's both Iraq and Lebanon that have been highlighted in those case studies. For Iraq, we're speaking about the climate change impact, and also Dr. Alia has been emphasizing about the situation in Iraq. So I'll not delve in more details about the hazards and the risks that Iraq is facing as a country. But mainly speaking about the the extreme heats and the prolonged droughts and the water scarcity. So, as an intervention by
Sorry for interrupting, but we're like very short in time. If you can like go over the remaining slides very fast so you can have enough time for the panel discussion.
Yes, no worries. I do have only 2 additional slides. I will go quickly and conclusion. So yes, without any additional delay, the interventions were like by installing the desalination units in Basra, which is like it's prone to the prolonged droughts and nationwide hydration campaigns. In addition to also Lebanese Red Cross being intervened in the cold wave early action, the heat wave interventions for multiple climate-induced hazards in the country. And in addition to the important topic that I have been hearing about from from WHO, from even AUB, is the EVCH. Each of one, it's the community-based like vulnerabilities and capacities assessment. We call it like this. But I've heard it also repeating from each of one, but each of one like calling it in a different name. So happy to be like hearing more about this and how we can like interlink or build more synergies between in order to save the efforts between each other. Yes, so as I foresee, in order to address this triangularization and to address more the climate induced impacts, we have within our strategy as something we call like a climate smart DRR. It's more how we work in a more smart way when it comes to our operations, when it comes to our response, and when it comes to our humanitarian interventions and strategies and programmatic level. So it's both about integrating the climate mitigation. Mitigation, we refer to it as a green response by greening the red, and also by the adaptation, different adaptation efforts. So mainly also EVCAs are part of it. And to end, just like I would like to strongly recommend you to be having like an eye on this important guide that we have been developing with the support of the Climate Center. It's mainly targeting on how the climate services, I'm referring by climate services as early warning systems, risk maps, seasonal health calendars, on how can be best big benefit of it in order to anticipate the health risks and reduce the forced migration or displacement. I've been trying to be quick as much as possible. So reaching the end, I would like to thank you so much for this chance. The time was not enough to show all the efforts that have been done by all the national societies. We're speaking about the big region, about 17 national societies, but I'm looking forward to learn more from my colleagues in the panel and also from you as AUB, and how we can like partner to bridge the gap between each other and to strengthen the resilience. Thank you all, and over to you, Hadil. Thank you.
Thank you very much, Miss Iman, and definitely very interesting efforts to hear about. So without being said, now we will move to our second round, which will take the form of a panel discussion. In this segment, the experts that we just heard from will reflect on the cases presented and explore shared challenges, lessons learned, and opportunities for strengthening climate-responsive health and mobility systems across the region. This panel session will be moderated by Dr. Michela Martini. Dr. Martini is a Senior Migration Health Regional Specialist at the IOM Regional Office for the North Africa and Middle East in Cairo, with more than 25 years of experience. In her current position at IOM, she provides technical leadership to governments, IOM country offices in the North Africa and Middle East, supports in strengthening health services for migrants and host community, including in conflict and protracted emergency settings, international health regulation core capacity to respond to health emergency, including epidemics, pandemics, climate change, health migration nexus, and labor migration health aspects. Dr. Michela, thank you very much. The floor is yours.
Thank you, Hadil, and many thanks to the speakers. I really enjoyed the presentation. They were very comprehensive, but also inspiring. As I can really see that the objective is clear today, how we can move beyond discussion to explore more evidence, the data, the country level lesson that can be translated and also in actionable solution each case study we have heard reflect definitely the urgency, but also the challenge to address the nexus health, migration, climate change, whether it's strengthening climate resilience and systems, addressing mobility, vulnerability, or preparedness adaptation measures. So the presentation today, I noticed not only the different entry point, but possible synergies like IFRC working in Basra, like IOM and WHO. So can be an opportunity to bring it further. But also, since the time was not enough, maybe we can plan next year to engage even more, given times also. And time is short for our debate, but I'm still curious to ask a few questions to the panelists if they're available. And I would like to ask if I can answer just quickly, 2 minutes, just to leave a few time if there are any questions. I would like to ask to Mr. Noran,
Yes.
just to you from AUB. First, also, thank you for organizing this event and to be such a great partner with IOM. Your study is extremely interesting. You showcases how mental health, verbal violation, and expenses, a problem with transport had really increased because of the climate change. My question is, to what extent in your studies, and do you think that people that you have interviewed have clearly understood how climate change affected their health, and which kind of misconception or knowledge gaps did you observe in those contexts? What do you think?
Thank you.
To really know that is the climate change the cause of their own problem?
Thank you,
Or
Dr. Michaela, actually,
yeah.
for raising this thing up. Actually, from our field studies, it became very clear that most participants did not have a clear understanding of what climate change actually is and how it might that be affecting their health and their daily lives. Like people were experiencing the symptoms, they are feeling the pressures, but they weren't necessarily able to make this connection in their minds between those experiences and the broader climate patterns around them. So what they did understand very clearly, and it was almost in all of the focus group discussion, it was common, was how limited resources were intensifying these health impacts. So when we brought this thing into this dimension into the conversation, they were able to respond very strongly. They spoke about the lack of water, they spoke about the high cost of electricity, the inability to cool or ventilate their homes, the poor housing insulation, the difficulty of maintaining clean living conditions, the inadequate access to clean water, for example, and so on. So all these factors made their symptoms getting even worse and limited their ability to adapt to any climate shocks. So for many, the main challenge wasn't only the climate event in itself, as much as it was their lack of capacity to cope, shaped by their financial strain, by their poor infrastructure, and their unequal access to services. But allow me to add one more thing, and that what was very encouraging in this matter is that once this link became clearer during the discussion, and after that we explained heat waves, cold waves, and so on, they showed a very interest and a very desire in engaging in workshops and training sessions to better understand what climate change actually is and how does this manifest in their daily lives and what they can do in order to protect their health and their families as well. So I hope I kept it short and brief as much as possible.
Thank you. Thank you so much. It was excellent. It's not surprising because most of the time the community, they don't recognize the real source cause of the problem unless they clearly see the water scarcity, the drought coming on, people talking about the drought. And this is important also in research and the programming, how we speak with them when we want to also collect an information. But thanks a lot to have shared very interesting study. It's inspiring also for a programmatic perspective. My second question is for Dr. Alia Mohammed. Nice to see you here. Congratulations for the great work of WHO in Iraq. I personally witness the great efforts that they are doing. And you really show the progresses also the countries, because we need to acknowledge that there is a challenge, but countries, they are quite committed in addressing climate change and health. So from your perspective and based on your work that interlinked the social determinant, the environment, the migration and health also, what can be a few practical recommendations if you have the opportunity to speak to government and partner in MENA? How they can, in few words, to make the health systems more climate responsive, especially in the setting with weak infrastructure, with limited access to care. What could be few practical recommendations from your side and from your experience to Dr. Alia?
Thank you very much, Michaela. Happy to see you again, and hopefully we'll see you in person tomorrow for our meeting.
Surely.
Thank you for the question, and I think one of the main things that I've been seeing with the government, and I've worked previously in Lebanon, and I've worked in Syria, and now in Iraq, and I can tell that health is somehow new when it comes to the climate response. Usually the health agenda, yes, health is heavily impacted by the climate, but they don't see the relation when it comes to the government. And this is what we've been seeing in Iraq, honestly. After COP28, we've been trying to introduce the health into climate and the climate into health. So, because the Ministry of Health thinks about health as something separate and mortalities and morbidities, and they don't see the lens of climate very well. And the climate people with Ministry of Environment, they see it in a totally different angle. So we're trying to introduce the climate into health and health into climate. And one of the things that we've been trying to do, and I really recommend from my experience in this area, is to connect the health to the national climate plans and development plans, especially when it comes, the Ministry of Health needs to put a clear role of health in the NDCs, which is the National Determined Contributions, into the national adaptation plans, into the disaster risk reduction plans. The health component needs to be there on the table when we discuss any climate action on a government level. On the contrary, when it comes to on the health sector, I think it's very important to integrate the climate into the primary health care. And I'm a big advocate for the primary health care package. We need to understand that the integration of health, heat health, the air quality, the water, the vector-borne disease, you name it, into the essential primary healthcare package, into the clinical guidelines, into the healthcare worker trainings. We need to even include the remote and displaced affected areas. We need to have the mindset of having the climate into the PHC level. It's very important. Let's avoid only thinking about the secondary and tertiary and going to the emergency when there's a dust storm or sandstorm or you name it. We need to start working on the strengthening climate resilient PHC. Also focusing on, we always neglect investing in people and communities that are highly impacted. And I think this is very important. We've done good steps, but I think we need to have more engagement and building the skills of the healthcare workers or the impacted communities, and to have more, I would say, local-led youth, migrant co-designed solutions. They know better what they need. They know more what are the gaps. Let's not sit in the offices and put solutions for them. And I'm a big advocate of having the engagement since the brainstorming into the implementation, into the M&E, including the communities and highly impacted people. So this is in general what I see really, what we really need as a first step to advocate for the health, climate, and migration agenda. Over to you, Michaela.
Thank you, Dr. Alia. I could not agree more on what you said. So breaking the silos of the three sector, because this is one of the challenges. The three together, health, migration, climate change, are quite relatively new in the domain also the public health and the climate change. Usually they had been silos, and this is why all our effort, they're really focusing on bridging So how we can integrate, as you said, health into disaster risk reduction, national determinant contribution adaptation plan, and including also the mobility angle, because now we have data that people is moving because of the climate change. Of course, it's in many cases life-saving activities and is a mitigation approach. So together we can really join with expertise of the three sectors. And your second recommendation, engaging community, that's definitely, I think, as also agency that will believe in the strength of the community. We totally agreed with you. Only with engagement with them we can prevent better, but also respond timely on climate shock and event. Mentioning the community, I will go to the IFRC for my last question, because they focus also a lot through the civil society on the community aspect, and also we see the intervention of them. It's really operational, rich in the community. So I wanted just to give the two minutes to Mr. Iman from IFRC. And the question is mainly still from your experience, of course. When you support the national society across the different and diverse fragile MENA context, what are the key lessons that you have learned and they emerge while you are implementing climate smart disaster risk reduction? So which approach do you think have proven and shows most practical and scalable area in facing both the climate stress and instability from your perspective and experience? Mr. Imana, over to you.
Thank you so much, Michaela, and it's a pleasure and happy to meet
2 minutes.
meeting
Sorry
you.
to cut short
So,
because
yeah,
yeah.
no worries at all.
Thank you.
So delving directly to the answer of this question, the first thing that is the change of the mentality. Like within our movement, when we speak about the movement, it's more related to the response, saving lives, or search and rescue. So we need to change the core and the baseline of the strategies by moving from the reactive to the proactive approaches, by moving the way that we think into more preparedness, more anticipatory actions that will actually save life. And this is the key figure that we know, that every investment in disaster risk reduction will save six multiple times when it comes to the response and the recovery. And another added thing that I'm gonna talk about is the community-led actions. Speaking about the movement, we are at the heart of the communities. We are based on the volunteers that are reaching the last miles of the communities. So we do believe on the power and the importance of empowering the communities in itself in order to do an effective solution. So focusing on locally led adaptation, focusing on the actual community-led solutions will be a must. And also importance of the anticipatory actions, and given that what currently we are dealing with the fund cuts, with the constraints on the funds, we need to bridge the silos internally within the organizations, like within each national societies, within the movement, and externally beyond the movement, bridging the silos, not working only and like DRR separately from the operations or from the operations wash house sectors. So it's important, as also Dr. Alea was saying, that's bridging the silos and focusing on the synergies in order to make it more effective. I hope I capture it within the time. And this is mainly the key lessons, and emphasizing the most important thing is the community trust and the community-led actions.
Yes, thank you so much, Iman. That's totally true, especially what you said, the trust, community trust, and it's not something that you can activate it when you are responding only. So it takes time to prepare to building. So the area of preparedness is extremely important. I totally agree. I thank you also to have been concise. And my last question, it goes to Dr. Mahmoud, my colleagues in Iraq. Thank you for your excellent work done in the countries. Dr. Mahmoud, you explain very well still many gaps and challenges that are still untapped, etc. But what do you think are the biggest evidence or data gaps that may continue to hinder a full understanding of the climate impact on health and mobility in MENA? And how do you think your program is trying to fill those gaps? Briefly, in a few minutes, if you can. Just, I know it's long, it may require a long question.
I'll try to be very brief. Thank you so much, Dr. Michaela. Actually, I think we have a kind of a bigger problem. It's not only in Jordan about the literature in general when we are talking about climate change, and especially when we're connecting it to health. And it's going to be much more difficult when we're actually adding the migration lens into that. So that's I would say that the challenge that we're facing with taking evidence-based decisions among the country within different sectors. So research is one thing, but once we are talking also about data, unfortunately, most of the data or the live data related to climate change that we have on the national level is not including the migrant population or the migrants community in general, which is excluding them from the interventions, the decision making, and so on. So the main goal, or let's say our aim in IOM when we're talking about the climate change, is to concentrate on these migrant communities and migrant populations, and also to include them and put them under the radar of the stakeholders and the government in general. Our program is trying to work more on the research component, especially when we're talking about the health impacts of climate change, which includes the mental health and also the other health-related issues, and also to raise more awareness on the stakeholders level about this component. Back to you, Dr.
Thank you so much, Dr. Mahmoud. I think we have reached perfectly the time. And I believe that we have reached actually our aim in this workshop. From the panel today, we really, I feel like, shed the light on several critical dimensions of the climate change, health, and migration in the MENA region. From WHO Iraq, we were reminded how the importance of climate responsive health systems must be rooted in a stronger primary healthcare services, resilience infrastructure, but also intersectoral coordination and breaking the silos of the three: migration, health, and climate change. And exactly the emphasis on integrating climate consideration in the public health portfolio and vice versa. And from Jordan, Dr. Mahmoud, we heard our persistent data and evidence gap, whether mobility, partners, subnational climate risk, health outcomes continue to limit our ability, particularly when we are relating to migrants, as you just said now. There are not enough data disaggregated for migrant in the health sector. We need to emphasize more. But it is, at the same time, it is encouraging, I think, in my perspective, because we see progresses from the countries, both from Iraq and Jordan, from government and partner with the development of National Adaptation Plan, Health Adaptation Plan. From IFRC, we see the perspective of the community and the importance to scale up climate smart disaster risk reduction, to make it more practical, to reach the community, to build the trust, and having a community engaged in our project. And from the Global Health Institute at the American University of Beirut, Dr. Nouran, we really heard about an interesting study discovering new linkages of the climate event with, as I said before, health and mental health and the social determinant of health, so lack of income, increase of the cost of the life, and also interesting that majority of the people interviewed, they don't recognize climate change as a cause, but they feel the impact. So basically, what is the community is seen experimenting is the impact of climate change, which at the end is a multiplier of existing vulnerability, as we know. I think as one message, I could clearly see the science systems and the community, they really must work together. So evidence is true, must lead to action, but the action must be inclusive, anticipatory in their perspective and more sustainable, but also vice versa. Lesson learned from the action can really influence the development of the policy. I think as we move forward, let's really carry the today's lessons into our program as agency, try also to build more synergies, to have more discussion like today's, also to identify possible partner where we can work together. It would mention reduction of funding, donors, so this is the moment where we are asked to do more with less. Only with partnership we can really go ahead. So from my side, I will give back the floor to Hadil, and thank you. And hopefully see you in 2026 for a new webinar.
Thank you, Dr.
And to the participant, I want just to flag, if you have interesting experience or program from the field, please approach us. You can be a speaker in our webinar. Right? Over to you, Noran, and many
Thank
thanks.
Thank you very much, Dr. Michaela, for moderating this session and for your notes as well. And of course, a special thanks to the panelists as well. I believe you all contributed to this very insightful discussion. We did receive a few questions across in the Q&A chat box that were directly answered by some of the panelists. So thank you for that as well. But of course, if anyone has any questions, feel free to add it in the chat box, or you can directly reach out to us by email, and we would be more than happy to support you and answer your queries. So thank you everyone for attending and for contributing. This session again was part of an ongoing collaboration between IOM, RO-MENA, and the GHI, and we look forward to continuing these conversations, as we work collectively to advance the climate responsive health and migration strategies across the region. We appreciate your participation and we wish you all a wonderful day. Thank you.